Hello, doctor. We have. I want to read your title
Okay.
because you are the division chief at the Division of Vulnerable Populations
Right.
at Zuckerberg Hospital. And for this conversation on the causes of homelessness, I asked like 4 or 5 different leaders in the issue on the issue in the space. Who should I bring? And everyone said, if you can get Dr. Kushel, she is the expert on this issue. So first, tell me. I want to set some context. What does that mean that you were? What do you do at the Division of Vulnerable Populations? What does that actually look like?
Yeah, so I'm actually, believe it or not, a practicing general internist. So I still see patients at San Francisco General Hospital, which I've been doing without disclosing my age since 1995. And I have training both as a physician and as a researcher. So I did a bunch of sort of graduate work in how to do research. When I came out here for residency, I thought what I was going to do was work on the issue of the working poor. That was like my passion. I had done stuff with unions. I was going to work on getting healthcare for working people. And at the General in the mid 90s, when I was a resident, half of the inpatients on my service were homeless. So we would admit them to the hospital. I would be like asked all these questions like, what's the 15th most likely cause of medium vessel vasculitis? And I would have to like spew out every study on medium vessel vasculitis. And we would give all these fancy medicines. We would discharge people. And 2 days later, they'd be back and they'd be in worse shape. And in fact, when we discharge people, because like the intern is the person who has to take care of them and has to tell them they have to leave, I would have these patients begging me not to discharge them because I was discharging them out into the cold, into the rain. And I think I just sort of, about 6 months into my brutal intern year, was before duty hours. We worked about 100 hours a week, 110 hours a week. Susan knew me back then. I was working, I would do 40-hour shifts, go home for 12, go home for 6 hours, work 12 hours, go home, come back for 40 hours. I just thought this doesn't make any sense. This isn't how I care for people. This isn't what I meant to do. And I switched my focus to focusing on trying to end the homelessness crisis. You could say I clearly have not done a good job as the crisis has gotten worse and worse. But I started by doing a series of studies, started to do policy work. So now I spend most of my time doing research. I lead a big research team. We have about 40 or 50 staff members. We work with folks all over the state. But I also do a lot of policy work at the local, state, and federal level.
Awesome. I'm going to try really hard. Well, I was going to ask you about vasculitis, but I'm not going to ask you about that. I'm going to try to keep my questions to the theme of the evening because normally we try to, when we do talks here, it kind of goes all over the place because that's kind of my personality. But tomorrow we're doing a deep talk on the history of homelessness in San Francisco, how we got here. On Thursday, we're having an amazing panel on what is the city doing to address homelessness and nonprofit providers. So a full scope of all the things, both public and private, that are being done to address homelessness in our city. And then the fourth evening on Friday, a debate on what should be done to address homelessness. And so, of course, as an expert in this, you're welcome to give me your thoughts on any of those things. But I am going to try to keep our conversation about what's causing this. So,
Yep.
my first question is: what do you think is the greatest misconception on the cause of homelessness in San Francisco?
So the greatest misconception is that all these people are coming in from other places because San Francisco is such a great place to be homeless. It isn't, and they aren't. And I think the greatest misconception is that the reason that we have such a bad problem, is because of our substance use and mental health problem. I think that those are the misconceptions. I understand entirely why people have those conceptions, because there's no question that the visible homelessness that you see, people with substance use and mental health problems are way overrepresented. That is not controversial. But I like to think about it as asking two different questions, and when you can see these are subtly different questions, you come up with very different answers. The question I think most people want to know is, why are there so many people homeless in San Francisco? When I go back to home in Kansas City, there are fewer, homeless people. I'm from New York.
I was going to say,
No,
am I talking to a
I'm from New York.
Kansas
If you
Cityan?
can't
Okay.
tell, you're definitely talking to a New Yorker. But people sort of think where they think of other places that have less, and I think that's what people are asking. And there has been really, 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 really compelling research on that. I don't think anyone who studies it disagrees. that the difference in community level of homelessness is entirely trackable by the availability of housing for the lowest income households. And it's actually like, I'm going to get all math geeky here, but when you like do linear regression, you do like regression analysis, it's like a straight line. It is absolutely clear that the bigger the gulf between housing for the lowest income households and the availability of housing, the more homelessness there is in a community. And in fact, when you see that gulf increase, you see homelessness rates in a community rise. Now, there's a different question, which is also an important question, which is, why is this person homeless? And this person homeless is often homeless because of some barrier that they're facing, not always, but often. So I think there are a couple ways to think about it. One is, I think about homelessness as an interaction between these big structural factors. So things like the availability of housing, availability of how much low-wage workers make or how much benefits are, the availability of a safety net, and then what we call the presence or the absence of of the safety net, and then the individual risk factors. So if anyone's here ever traveled to Northern Europe, like we go, I get to travel, go to all these places. Everyone else wants to go to the museums, and I want to go see where homeless people are living. But even if you're in Northern Europe, there are people experiencing homelessness, even though their income structure is pretty flat. They've got lots of available housing. In a place like Northern Europe, the people who are homeless are people with lots and lots of individual risk factors, things that really decrease their ability to stay housed. In the United States, in 2023, you don't need a lot of individual risk factors to become homeless. However, if you have those individual risk factors, you are more likely to become homeless.
I have a couple follow-up questions. The first is to your very first point that the misconception is that folks aren't coming here.
Yeah.
How do we know? There's something around 8,000 homeless people in the city by the last count. Yeah. How do we know what percentage of those folks were living in San Francisco when they became homeless, and folks that have come in from another place? Like, is that data actually understood?
I mean, one is we ask people, and others is you can use things like Social Security records, tax records, other forms of records. And it looks like in San Francisco, a little over 70% of people who are homeless lost their housing here. And in communities across the country, that number varies between 70 and 80%. We're slightly on the lower end because we are a place, for instance, where queer kids can find safety. And I'm very proud that we're a city where queer kids can find safety, and that is a group of people, right? And so the reason why we're slightly on the lower end of the spectrum is because we are a place of sanctuary for certain communities that, because of various oppressions, are at very high risk. But otherwise, across the country, before the pandemic, traveled a lot to give talks like this, and I would come home and my sort of sardonic New Yorker husband would say, so how was, Columbus or whatever? I was like, you're never gonna believe it. He's like, let me guess. Everyone in Columbus, Ohio is convinced that everyone is flocking to Columbus, Ohio to be homeless. And they are, actually, I will tell you. They are. Everyone believes that, but it just doesn't really hold water. People move a little bit, but there's not a big sucking sound.
Okay, and to your, so the first was that people, move here, and the second is about how, you made a point about housing.
Housing, yeah.
Talk to me about New York, because New York has a right to shelter.
Yes.
New York's housing costs, I'm not an expert in this, but the average one bedroom is about the same as San Francisco, roughly.
Yep.
Too much.
Yeah.
It's hard out there. But from what I've been told, it seems as though there's fewer street homelessness, less street homelessness, and the reason is because there's 500,000 people in shelters.
Right.
So how does our shelter capacity and population reflect per capita kind of where other cities are? Like, i.e., is part of the reason why there's a lot of homeless folks in the street because we don't have enough shelter beds?
So I'm a New Yorker. New York, if you walk around New York, it looks like there are a lot fewer people experiencing homelessness. New York actually has a higher per capita rate of people experiencing homelessness than San Francisco and LA. It's the only place in the country that does, because it has all the negative conditions of the high housing costs and the big split. New York, because of a lawsuit in like the late 70s, early 80s, has a right to shelter, meaning anyone who experiences homelessness has the legal right to demand shelter, and the city is required to give it. And in some ways, that's good. In some ways, it's really cold in New York. You know, people are not, and for businesses, it's better, right? People are not in the streets. But I can tell you that when we look at the health outcomes of people experiencing homelessness, there's actually no clear difference between being in a big homeless shelter or being out on the street, absent conditions like freezing cold. Obviously, if you're going to freeze, you know, if it's 30 degrees, you can't be outside.
Wait. So just to make sure I have that right, there was a study that showed that the health conditions of living, I think it's called sleeping hard, out on the street,
rough.
sleeping rough. The health outcomes are not demonstrably different than sleeping inside in a shelter.
So it's a little hard to show, but so you can see the problems in a place where there's a right to shelter. If you're in New York, the people who are outside are much sicker. And that is, if you think about it, if you have a legal right to shelter, and it's either, New York is like two temperatures, it's either too hot or too cold, right? I mean, if anyone spent time there. And so the people who are not in shelters are often people with very significant substance use or mental health problems, and they've either been kicked out of shelters or they don't want to exercise that right or they can't exercise that right. They tend to be sicker. So we have a bunch of research from New York and Boston, which is nearly a right to shelter. It's a little more subtle city, but where most people, 95, in New York, 95% of people experiencing homelessness are in shelters. Clearly the people who are out of shelter there are sicker, but it's not clear that it's because they're out of shelter. In California, we almost have the opposite problem, which is that shelter is so restrictive. We have so few shelters that often in our shelter system, it's often older, frailer people who are getting referred to the shelter beds. And so if you just look, the people in shelter in California are sicker. It doesn't necessarily mean the shelters are getting them sicker, but there's no compelling evidence that moving someone from outside, absent terrible weather conditions, into a big congregate shelter, that they're healthier.
But I'm not going to argue with an expert here, but it's going to sound like it. It sounds like what you just said, though, is the reason why there isn't a difference isn't necessarily because shelters aren't better for people, but because the shelter population in New York is different than the shelter population in a place like San Francisco because of capacity.
Right.
I want to make sure
right.
I'm understanding it
I
correctly.
think
Because I think from the like basic observer, you see someone sleeping on your street and you're like, just get the person into a shelter and they will start being better. But but is that incorrect, I guess?
Yeah, I mean, I think it sort of depends on what the shelter is, right? I mean, during the pandemic, the shelters were horror stories because COVID, you know, remember we were doing a lot of work in the shelters and on the streets, and you know, the first person who got sick at Mission South, within a couple days, 75 to 80% of people were infected, which had been our big fear all along. It turns out during the pandemic, you were better off outside, the same reason like people like me like to eat outside and not inside. There's just less COVID transmission outside. But I think the answer is it depends. The big New York shelters will have 400 to 800 people. They can be pretty, I've spent time in them. They can be pretty violent places. People don't have privacy. People don't actually have great hygiene, even though like that is the big advantage of shelter. One of the big advantages over outside is that washing facilities, things like hepatitis A that are spread through not having access to like hand washing and stuff, should be better. But in some of the New York shelters, if they're huge, they aren't. You know, smaller shelters where people have some privacy can be a lot better. But the truth is, it's hard to build those to scale for the same reason it's hard to build housing to scale.
Okay, let's talk about the other thing you mentioned in my wham bam question about causes, which is substance abuse and mental illness. I feel a lot of my friends and I, when we talk about this question, it feels a bit chicken or the egg. Like, you know, people develop substance abuse and mental illness because of the traumatic nature of being homeless and sleeping on the street. Whereas I've heard other people say, the people who are on the street are there because they couldn't hold a job because they were an alcoholic or they got into meth. And so in your experience with the population, kind of not is it chicken or the egg, but like can you help us understand a little bit more of like is it more likely that one is causing the other, or is it that people who have these illnesses, because there isn't a strong net for them, they're more likely to drop into homelessness?
So I think
That was the most convoluted
I
way
got
to
ya.
ask that question. I am so sorry, audience. Woo!
I followed
Get
you.
me out of here.
I'm gonna either give you a very unsatisfactory, like the answer is both. So like
No, don't say that. You're the doctor. We want the answer.
So my favorite analogy, which there's this great book, Homelessness as a Housing Problem. It was written by Greg Colburn and Clayton Aldern, and they called me to interview me before the book, and I used this analogy. They later told me that like everyone they talked to used the analogy, but I thought that they pulled it together better, which is think of musical chairs. Have anyone here ever played musical chairs? Like at a kid's birthday party, like 10 kids, 10 chairs, you play the music. The parents
I always got very aggressive at this game.
well, right. And so the kid, you pull away a chair, turn off the music, and the kids scramble for the remaining 9 chairs. So imagine a birthday party, and one of the kids was playing soccer the day before and sprained his ankle, has like crutches that are too big for them. They don't really know how to use them. They're crutching around, right? You pull away the chair, and you ask the question, if you had to take bets on which of the 10 kids was going to still be standing, because Manny, you'd be aggressive, right? You'd be diving for that chair. But the kid, he's on crutches, they can't dive for the chair. They're more likely to be the kid left standing. So if you ask the person, like, why is this kid standing? Why is this kid standing? Well, it's because they're on crutches. If you ask the question, why is there a kid standing? It's because you only have 9 chairs. And if you had 10 chairs, that kid would have eventually gotten to a seat. And if you only had 9 chairs, either 2 kids would be sitting on each other, which happens, or someone would be standing. So in California right now, we are the 2nd worst state in the nation on this key statistics. We have a whopping 22 units of housing that are affordable and available for every 100 extremely low income households. So we have a lot of people stacked on chairs. And I can tell you in the first days of the pandemic, for a variety of reasons, I signed up to call everyone in our clinic who was getting diagnosed with COVID. Now, all I do is housing. I think about it all the time, and even I was shocked.
I have to say, for someone who has to deal with such a seemingly intractable issue, you have a very sunny disposition. We're gonna need to have a separate interview about
Right, what's
how
wrong
you
with
keep
me?
that.
It's the hibiscus tea, which I strongly recommend, by the way.
We spiked it, y'all.
I know, really, maybe you spiked it. But I was calling people, and first of all, I have this email that I sent on March 30th to leadership in the city saying I haven't had one conversation in English. Every single conversation I'd had was in Spanish. And I was like, does anyone else notice this? And of course, as you knew, at the early days of the pandemic, it spread through our Latinx community here. But I was calling people, and inevitably there would be a person who was infected, and I would talk to them, and they were out working. They were a dishwasher. They were working they couldn't stay at home like so many of us could. They got infected, and I was like, we didn't even have contact tracing set up, but I kind of knew the principles of contact tracing, so I'm like writing down on scraps of paper, who else is in your house? How many bedrooms do you have? How many bathrooms you had? And it was like 14, 15 people in a 1-bedroom house. And I would call the next day to check on them, and 4 of the people would be sick, and the next day. So we have this problem in California. We are 1 million units short of the housing that we need for extremely low-income households. And 99.99% of people experiencing homelessness come from the lowest income households. We just came out of the field, Jerry knows this, of this big statewide study on homelessness across the whole state, rural, urban, and the median household income in the 6 months before losing your housing was $950 a month. The median rent people paying were about $400 a month. So both things are true. If your household makes $950.
Let's say that again. So the
Yeah.
median, because
It's a statewide.
I'm getting my
Yeah.
mental pen out. So the median income
Right.
of what percentage of people who lost their housing?
Everybody.
Of everybody.
Everybody who was homeless in California. This is a representative sample of every homeless adult in the state. Don't ask
Was
me how we did it.
$950.
$950 a month for their household. The median rent they were paying ranged from some areas, the lowest was $400 and the highest was $550 a month. So both things are true. If your household makes $950 a month, you can't actually sustainably spend $500 of it on housing. You can't eat, you can't save money. You're like one tiny disaster away from the streets. But also, where are you going to find housing in this state for $550 a month? Both things are true. So we have this huge huge structural shortage of affordable housing. That's like another whole sad story of how this state got here, but that's why homelessness is so bad in
Okay,
this
but
state.
just back to the chicken or the egg.
Oh,
I,
right.
I understand the kind of duck
Right.
duck goose
Right.
analogy,
Yeah.
but like, but also,
Right.
and again,
What
I'm
gets
just
worse?
taking
Yeah.
from the perspective of walking
Yeah.
down the streets and you see folks
Yeah.
that seem to have
Yeah.
schizophrenia
Yeah.
or seem to be dealing with substance
Yeah.
abuse. Like, what is the
Yeah.
percentage of folks who are dealing with those issues who are homeless in our city that you know of?
If you include everybody in the city who's homeless, it's about, and it depends what you count as substance use, but it's about 40-ish% at least have substance use problems and mental, it sort of depends what you count, how strict a definition you use, much higher than the population as a whole. But I'll say to, as a doctor who
What
doesn't,
is the I'm sorry to interrupt you. What is the population as a whole? Like, what's the
oh, if
difference?
of that number, it's probably threefold higher or something. It's significantly higher than you would expect. But partly it's the who loses out in a really tough housing market, who can't double up. If you're doubled up with 15 people and you're using and your family's furious at you, you're going to be out, right? So it's all of those things. But the other side of it is, as like a doc who's been doing this for a long time, and a lot of my practice is substance use. Like we can treat most substance use pretty well, some better than others. But what I need to treat people is I need the ability to get them invested in their care, to get them interested, to get them feeling safe with me, to agree to take it. And I can tell you we're pretty good at it. When people are homeless, we've got nothing. People get victimized, they get raped, they get physically assaulted on a really regular basis, they get no sleep, they feel hopeless, they can't do anything. And so it's chicken and the egg, both because homelessness just makes everything worse, but also like substance use isn't static, right? People get better and worse with time, and their families and their healthcare community. We're all trying to get them into the better part, and it's much harder also to get people better when they're homeless.
Okay, I have a couple more questions. Then I want to honor my promise to keep this very audience focused. Talk to me about demographics. You mentioned queer kids, of course,
Right.
but can you talk to me about the demographics of folks that are experiencing homelessness in the city?
Yeah.
You've also mentioned Spanish language
Yeah.
versus the city's population as a
Yeah.
whole.
So the thing that every single person in this room, or every single certainly white presenting person in this room, should carry as our shame with us, is that our city right now has fewer than 6% of San Francisco's population is black, and 38% of those experiencing homelessness are black. 38%. We are worse than the national average. Nationally, black Americans are at a 3 to 4-fold increased risk of homelessness. In San Francisco, we're significantly worse than even that shameful thing. So when you think about that, like the primary means of intergenerational wealth building in this country has been through housing. That is how certainly how my family, got the money together from, sort of Holocaust refugees and like, factory workers, and then someone got a job, and like the house that my parents bought sent the 3 kids to college. They pulled money out of the house, and that's how we went to college. They were able to buy that house because they were white folks. And black folks, until very recently in our collective history, were legally basically restricted from buying homes. It was immoral, it was unethical, it was totally racist, but it was totally legal until the fair housing laws were passed. And so this operated through a variety of mechanisms. Black folks were, there were racial covenants in neighborhoods, so people could say, you cannot sell this house to someone who's black. So entire neighborhoods were sort of white, basically. And then the banks got in on it and basically said, if you live in one of those areas where the black folks were allowed to live, I don't have to give you a mortgage, or if I give you a mortgage, I'm going to charge you serious rates. So black Americans were basically excluded from the US post World War II expansion in home ownership. I like to say that I live in subsidized housing because I do. My husband's an attorney, I'm a physician, we own our house. And our housing is deeply, deeply subsidized by the federal government because we didn't have to pay taxes on all of our mortgage interest, right? You get mortgage income tax deduction. That was a policy and is a policy of the federal government as a way to stabilize communities, but guess who was left out of the ability to buy into housing? So the lack of home ownership is the biggest reason for the black-white wealth difference. that also means that if, we are like sort of hippies, and we live with, I always have someone else, at least someone else living with me.
I was going to say, I would love to know what your definition of a hippie is.
You should come to my house. Have you over for dinner with the 40 other people who are crashing there. But like, we always have people living with us, and nobody can tell me no, right? Like, I have like someone's friend's cousin or whatever staying with us, they need a place to stay. If you rent a house, you can't do that. And so, for instance, what we see in our studies of, there's this whole mythology like, oh, people who are homeless are disconnected from their families or friends. That tends to be true in the white community, where folks who are homeless are often people who have burnt bridges with their families or friends. Not always, but often. In the Black community, we just don't see it. It's that their family or friends love them, are connected to them, are coming out to visit them, but their family or friends are renters, and therefore can't just have the option to bring in whoever they want to stay with them.
What about, thank you so much for that. That was both horrifying and illuminating. Um, in kind of the last few minutes before we open it up, I am going to venture to ask you, even though I promised I wouldn't, to talk a little bit about what you see as realistic, expedient solutions to this problem, given your medical perspective and your policy perspective. And I'm going to challenge you to not, I'm going to take building sufficient permanent supportive housing for every homeless person off the table, off the equation. And the reason is, and maybe I'm being too much of a realist here, it's because I don't think it's an expedient enough solution. I just don't know that how you can't. The city can barely build enough housing. Period. The idea that it would be able to quickly build 9,000 units of permanent supportive housing for every person sleeping outdoors seems to me very far away from possible. So if we take that off, I'm not saying we shouldn't fight for it. I'm not saying that it isn't the right solution, or is or is not. But let's say we take that off the table. What can we do to address maybe the most kind of painful or serious, I guess, I don't know how you even define that, of situations of homelessness in our city in something that might approximate expediency?
Yeah, I mean, one answer is there is no, we are in such a deep hole that we're not going to get out of it anytime quickly. That's where my sunny disposition goes away. I wish I could tell you I had a magic wand. There is no easy answer here. There is no easy answer. It's not going to go away anytime soon. But I think, we always talk about like the first thing you do when you're a hole is you stop digging, right? And so we have massive numbers of people falling into homelessness, and I'm very worried about what's coming next year. During the pandemic, we all anticipated that there would be 30% to 40% increases in homelessness. And a couple things happened. The local, state, and federal government were like, oh my God, we can't do this. So they did some very good things. We pushed out unprecedented numbers of rental assistance. We pushed out we did Project Room Key, which I helped found, which was the hotel rooms when people were homeless, and then Project Home Key, where they're like quickly brought new housing online. And we had eviction moratoria. The problem with the eviction moratoria is that they didn't, so you were not allowed to be evicted for most reasons during the pandemic. Those have been lifted, but they didn't catch people up on their rent. So we now have unprecedented numbers of people behind on their rent. The first thing that I would do is fix that, because we're, like LA put all this money into homelessness, housed thousands of people, and for every person they housed, 1.7 wound up newly homeless. So we've got to stop the bleed, and we've got to, frankly, by any means necessary, right? We've got to bring people back on their rental arrears. We've got to be much stricter about who can be evicted and things like that. I think we have to get more creative. Most people don't, not everyone needs permanent supportive housing. People need permanent rental subsidies, but they don't need permanent supportive housing. And probably most of the people in this room have lived with roommates. We're gonna need to be a little bit more matching people up, letting them choose who they live with, and making it easy for people to use various forms of vouchers with other people of their choosing. There's a really good, I think, sort of a mental frame of that you can't do what New York did and just build shelter. Because if we just build shelter, all those new people are going to still keep being homeless. And no matter how many shelter beds you build, you're going to just have more and more people coming in, and everyone will just get crowded in the shelter. You need to have outflow. You need to have people going into housing. So like the mental frame is like 1, 2, 4 is what we all agreed on with this Bay Area, 9-county Bay Area region. I personally was pushing for 1, 3, 6. But the idea is that for every shelter bed you create, you need to sort of identify or create 2 units of permanent housing and 4 units of prevention. 4 units of prevention are like you need to stop people falling into homelessness. And that's a good algorithm to have. You know, Prop C raised a lot of local money, and
I
people
will
are,
say you did kind of just break my rule.
well,
But that was a loophole.
but it's
But we'll give
not
it to you.
all creating new housing, right? It's not all creating new housing. San Francisco is the only place that I know that did all of their housing in like one district and all new buildings, right? You can actually move people to other communities using a combination of rental vouchers and things like that. There's a lot more creative things we need to do, but you know, when people are in homeless shelters, they're still homeless. And for every person who's in that shelter, there are going to be 2 more. It's not like a fixed group of 7,500 people who are homeless. It's people coming in and out all the time. And you've got to increase the number of people leaving and decrease the number of people entering. But it's
Okay.
not going away anytime soon. There goes my sunny disposition.
Well, this was just part one. So maybe by the end of the week we'll come up. We'll find some additional solutions that. I'm going to ask that same question, obviously, throughout the week. Okay, let's get to the audience questions. I'll remind you that Dr. Kushel is probably the most well-versed expert in the city on the causes of homelessness in San Francisco. So ideally, keep your questions towards that. Precious has a mic. We're going to actually hold the mic in front of you versus giving it to you. So raise your hands. All right, right over here.
On a really basic level,
Or you can project,
describe
yeah.
the distinction between permanent supportive housing
Yes.
and regular housing.
What's the difference between permanent supportive housing and regular housing?
Great. So, so what I like to say is everyone who's homeless needs housing, and what we found is short-term housing doesn't tend to work very well because the income gap is still there, particularly in these high-cost cities. Permanent supportive housing is a form of housing where there's a permanence to it, meaning people get a lease, they have some form of subsidy that's not time limited. It's not going away in 2 years or 1 year, et cetera. And the supports are, it has voluntary, this is where people get all upset about, but voluntary but available services to match the needs of the person. So it is the evidence-based way to solve homelessness in people with chronic homelessness, they've been out there for a while, with behavioral health disabilities. You know, lots of folks are housed with really bad behavioral health disabilities, and by that I mean substance use and mental health problems, but people need services and supports. The trick is if you mandate them, people don't take them up, and therefore it's a barrier to being housed. It's like reverse psychology here. If you don't mandate it, you start with the housing, you give people the security of housing, but you make those services and supports really available, it turns out, and this has been tested empirically, I've done it, people take them up and use them.
Got it. Right over here with the camel jacket.
Hey, I had a question about downtown. So downtown's a ghost town nowadays, and it's never really been that vibrant. What can you talk about kind of revitalizing, reusing empty office space as housing for low-income communities and potentially as homeless shelters?
So, I mean, I was really excited about this idea. God, everyone's complaining about empty office space. I'm like, housing. What I'm not is an architect or a housing developer. And my housing developers tell me there, because of the way offices are built, it often can be extremely costly to turn them into housing. Just the way that the windows are and the elevators are and where the bathrooms are and stuff. So there's apparently some office building that wouldn't be that expensive to turn into housing, and others where they say it would be prohibitively expensive, like harder than starting from scratch, just because of building issues. But I think that people are looking into, can we find housing wherever we can, and I think they're literally trying to find what are the characteristics of the building that would allow them to do it in a non-completely cost-prohibitive way.
All right, hands. I see a hand to my left, but yeah, let's go to the back and then we'll come around.
Speaking of housing, are you tracking any of the vacancy control type things? In my building right now, there's like 4 or 5 empty units all around me.
Yeah, I mean, the vacancy control stuff is a really interesting debate. Some of it is like, it sounds like there are real vacancies there. Some of the numbers are mirages because as people move in and out, they're counted as vacancy. It usually isn't that someone moves out and someone moves in the next day, and that all gets counted as vacancies. And you need some vacancies to allow people to move in and out, but there's no question that people having second and third houses, like foreign ownership and everything is using up a lot of the precious space that we have. And I'm all about we need more housing wherever we can get it. And to solve homelessness, we need to focus on those, not just affordable. Affordable housing is super important. That's how, I want my kids' teachers to be able to live in our community. I want every nurse and social worker I work with to live, in our community and not just have it be tech workers and physicians and super high paid people. But the truth is that the homeless community is very, very low income and is going to need a very deep subsidy.
Okay. Let's go right here, right in front of you. Yes, and then we'll go to Eric, and then I have not forgotten.
Yeah. Oh, sorry. You want to answer? Hold it. Okay. Yeah. Thank you. Yeah. So just setting aside housing, just because we've talked a lot about that, I'd like to know, after all the analysis you've done and decades and decades of homelessness here in the Bay Area, thinking of future generations and of kids in high school, what could we do today with those kids to prevent homelessness, future kids on the street from addiction? Or
It's a great question.
It's a really great question. I mean, if the question is, most kids whose families can, have housing and have wealth and things, then the big risk is, are they going to be kicked out by some behavior? Are they going to have an untreated mental health problem that you're not able to engage them in treatment? Or are they going to have a really disabling addiction? And there's no question that we need to do more. I mean, I don't know if you saw the CDC report on mental health stuff in teenagers last week. It came out, I have twin, almost 21-year-olds, and I would say it came out and I was like, gut punch. And then there was a shooting at Michigan State. And I was like, yeah, our kids' generations have grown up where they expect to be shot in school. Right? They think there's going to be no jobs for them. They look around and they just see incredible despair everywhere around them. So I think the most we can do is, for kids who grew up with a lack of wealth, it's to love them, to support them, and not to kick them out or something if they use, right? What we know with people who have substance use problems is that we used to have this metric of people used to hit bottom and you need to hit bottom. That has been blown. That is just not true. They hit bottom and they die, right? And it's really hard as a parent to show that love and compassion and support while you're helping them to build up their self-worth and sort of get them back in. I think we need, I like to use the word poisoning and not overdoses, because people who are dying of overdoses, it's not like they're dosing. They don't know what they're taking. Our drug supply is incredibly poisoned, and we need to work on our drug supply. And it turns out the more you push it underground, sometimes the worse the poisoning gets. We need to do all sorts of supports. I mean, the kids I most worry about are trans kids in parts of this country where there's so much anti-trans rhetoric. I worry the heck out of, for those kids. I worry a lot about kids exiting the child welfare system. If the state thinks that it's so great that it's going to remove children from their parents' care, so we should do it better. We have an obligation to not do what we do to those kids, which is abandon them, when they turn 21. We need all the things, we need high-paying jobs, and we need support, and we need love for all sorts of kids, and we need to work in our mental health system and all of that.
All right, over here, all the way in the edge. I'm sorry, Precious, making you. Yes, go all over the place.
Thank you, first of all. And can you touch on zoning laws in the Bay Area, and are the restrictive zoning laws in the surrounding Bay Area counties resultant in, does that affect homelessness in San Francisco?
We're giving you architect. We're giving you education reform. We're giving you epidemiology, and now we're giving you planning.
You should see what my bookshelf, my bedside table looks like. I read about everything except medium vessel vasculitis. Which I had forgotten. It's so damn boring.
Why did Beyonce not win the album of the year?
Exactly. Exactly. Oh, my pop culture is terrible. Just ask my kids; they make endless fun of me. But I think the issue is yes. I mean, I had this great this moment where Nicole Hannah Jones said in a talk I went to, she said the West and the North didn't need Jim Crow; they had zoning, which was this aha moment for me. And I do think that the suburban sort of fight against multifamily housing, against density, is definitely impacting us in San Francisco, and that it needs to be, and you see like the governor using some of his, not just his bully pulpit, because it's actually his pulpit to basically, with the Rhino legislation, to basically say to cities, if you can't get your acts together and come up with a plan to really build housing, we're going to take away all the party favors. We're going to really punish you. And that is starting, could start to work, but there's no question that, car centric, single family home zoning has led to a lot of this problem.
All right, we're gonna go to the other side. I'm gonna come back to the middle in a second, but let's go to the other side over there, all the way in the edge. We'll come back around
Okay.
to you. We'll go Plaid after that, and then this individual in the front row here.
Yeah. I'm very curious about what I think is an increase of sweeps around the country of homeless camps. And during my time in Florida, that was basically how they solved most housing issues. Like, basically get them out of Miami, get them out of the ritzy-ditzy luxury parts of it. And I'm starting to see that a bit more in San Francisco in terms of sweeping out and I think it's when I say attractive, it's like very easy to be like, oh, let's push the problem away, out of sight, out of mind. But I doubt it helps a lot. What do you think is a good way to fight against that? Or maybe it's good. I don't think so. Just want your thoughts on it.
And if I could actually add a B question to that is, what should be done if someone is taking over a sidewalk, or if there's a tent in front of a small business or someone's house? Like, what is the way to move the tent or the things around that person in the best way for everyone, I guess?
Yeah, and so I would say like the difference between like the sweeps, and thank you for asking that question. The sweeps are increasing, and you see like local politicians actually have the least ability to solve this problem. Like the federal government could end homelessness tomorrow, I'm convinced, right? Only one in
Ooh, how?
Right now, right now, for instance, there are lots of problems with housing choice vouchers. That's commonly called Section 8. It's a voucher that the federal government provides that you give it to a private property owner. I'm not to say landlord, but you give it to like the landlord, and you pay 30% of your income, and the federal government pays the rest. Lots of problems with it, particularly in high cost areas. Landlords discriminate against it. They're hard to use. Like, lots of people who need them don't qualify them. Lots of problems. Putting aside those problems, only 1 in 4 households who qualify for them get them. Like, that is not how we do other things. It's not like Medicaid, which now it's in California and in every state with expansion, it's based on income. It's not like you go to sign up for Medicaid and they're like, sorry, dude, 3 people signed up today, so come back in 6 months and see if there's room. In housing choice vouchers, there's like, it's California, San Francisco is like a 10-year waiting list that every couple of years they open for 3 days and then close again, because once it's a 10-year waiting list, why even bother? And so the spend to fully fund housing choice vouchers would be a little bit more than we currently spend on shelters, but only half of people who are homeless are in shelters. So if we actually sheltered everybody, it would be significantly more expensive than the fully fund housing choice vouchers. And in a place like California, housing choice vouchers wouldn't solve the problem overnight because there's no housing. But it turns out that the reason affordable housing developers can't build housing, they can usually get the state or local governments and some other federal tax things to build the housing. They don't have enough money to sustain it, because a household that makes $1,000 a month can't actually pay enough in rent to cover the operating costs. Housing choice vouchers would solve that.
Is everyone listening to this? Because this is what you say to your friend when they ask you, like, what could the federal government do? Like,
Tomorrow they do
Yeah,
this.
this is the
They could
good
do
right here.
this-
This is what we're talking about.
They could do this tomorrow. And, it took, like, I'm like a housing nerd, as you can tell. And so, like, I watch every debate and everything. And it was really not until, like, the last set of presidential elections that they were ever even asked one question about housing. Build Back Better didn't have a fully funded housing choice voucher package, but it had a pretty big expansion in them. And then it got cut. By the Senate. So, like, in this Senate, let's be real, we're not going to get it because this is a great wedge issue. Where are housing costs worse? Blue areas, the knowledge economy areas, areas where there are a lot of people want to live, where there's a lot of, wealthy people. What are those areas? Those are blue areas. And I worry that our own divisiveness in San Francisco, we're playing right into the red, blue, like, war games here. So the Republicans have no incentive to solve this problem because they're watching the Democrats that eat each other alive over these issues.
And then, sorry, just my addendum question about the best way to address an encampment that also understands kind of the underlying causes of homelessness.
So the sweeps, the problem with the sweeps, exactly as you said, is they're just moving people from one area to another, and there's a lot of harm that happens with sweeps. People's entire lives are on their person. Their documents, like, first of all, their memorabilia, their photos, their, whatever, but their documents, their documents that could get them into housing, their medicines are. If I had a penny for every fight I've had with insurance companies where I need to refill someone's medicines because they've just gotten thrown out in another suite, I'm like, oh my God, this is my own government. They're working against me here. Like, I'm literally begging. Like, medicines get thrown out. People's social ties get disrupted. People's outreach workers, anyone here who does, homeless outreach work, you go out and you can't find people anymore. They cause a lot of harm and they don't solve anything. It turns out if we actually had housing on offer, people would leave the encampment very happily. But they're often not going to leave it for a big group shelter where they can't go with their partner and they can't go with their pet and they can't go with their belongings. But sweeps are just not only not solving the problem, they're causing a lot of harm. I think you're asking, Manny, like, what do you literally do if you're walking down the street?
I mean, here's an example. There was a person on the corner for a week and a half.
Yeah.
Fine gentleman,
Yeah.
was an alcoholic. He offered himself, was homeless, had 4 or 5 carts full of trash and household items at the corner of 16th and Valencia, refused help, refused to move, was in front of La Cumbre. And Sam Dodge sent out his teams. There's a team of folks with counselors, with medical advisors, with all the people to talk and offer things. I'm not leaving. This is where I want to be. This is my shit. Don't touch it. DPW couldn't throw it away because you can't throw away possessions of someone if they say that this is mine. 5 shopping carts full of stuff. It does seem inhumane to, like, grab something from someone and throw it away. At the same time, the other extreme of that is saying you can have everything you want anywhere you want. Seems like an extreme answer too, because, like, if anyone was able to put anything anywhere on a city, it would affect commerce. It would affect people. It affects the street conditions. I mean, the street conditions in our city are deteriorating as well. So understanding all the complexities of that, is there, like, an ideal way or the least harmful way to move someone from one area where they have all of their important things to a different area? And is there an ideal area to have all your things, perhaps?
Right. I mean, that is the problem. Like, we're in a very small city and there's not that many areas. I mean, I think best practices are, first of all, engagement. Sometimes this can take some time. Folks who experience homelessness have a lot of reasons to distrust everyone around them. And this is hard, right? Because it's hard to, like, not solve it right away, but people can be very distrustful. So there is, like, best practices of building trust. There is best practices of, like, there are communities that have storage facilities that they can, assure someone they're not going to throw it away. You can get to it whenever you want. It doesn't always work. But we are running out of space in this city, and it is a problem. Like, I'm not going to stand here and say that isn't a problem. I can say, though, the flip, like, I was, as Susan knows, I'm a swimmer, and I was walking to the pool a couple weeks ago. I live over in central Berkeley now, and there was a woman lying across the sidewalk. And, maybe because I'm a physician and I feel pretty comfortable with this, I like knelt down. Looked ridiculous. I was in my swim parka and like no pants on and my bathing suit. But it was like going down to 40 and she was shivering. And so I leaned down and just started to talk to her and ask her if she was okay. And she was like, I'm freezing. The first thing she said to me is, do you have a blanket? So I actually called my poor long-suffering husband who came over. I was like, I need blankets and I need a lot of food. I took some orders from her, like, are you allergic to peanuts? Because I want to get you something high protein, But like, he came over the blanket and food, and we sat with her and talked to her for a while. And I said to her, would you be willing to go to a shelter? It's really, really cold. And she said, absolutely. And then we like found her a shelter, and my husband finally put her in his car and took her to shelter, and I went off on my swim. But like, what was really striking to me is she kept saying to me, like, she literally said to me like 10 times, I can't believe that you talked to me. And like, I live on a busy street. There were a lot of people just stepping over her. So I would also say, like, she wasn't resisting shelter. She didn't really want to be lying there. My husband came out of the car with like leftover food, and he had like brought like fork and knife or whatever. She was so hungry that he handed her the food, and she just started to like grab it with her hands. And I was like, Jess, I have a fork for you. But she was starving and shivering, and no one had stopped to check on her. And so I think that's the other thing. She just said to me like 10 times, I can't believe you stopped. I can't believe you stopped. I can't believe you stopped. And I thought, what are all my neighbors doing? It's not like, this is like a young woman it was 40 degrees. She was shivering and she was starving. And this is in central Berkeley, and nobody had stopped just to say, all I said to her is, are you okay? And then we started a conversation. And the whole thing took like 40 minutes or something. I still got my swim in.
All right, in the front here. Oh, yeah.
I'll just say, I was just curious, earlier you said, like, we need to help folks get caught up on rent. Who's in charge of that?
Yeah. So that's a great question. So there are, the state is going to have a terrible budget year. So the federal government doesn't need to balance their budget. The state does by its constitution. And California, as you probably know, has the biggest, widest extremes in tax income because so much of our tax income is like capital gains tax or whatever. So last year was really great. This year is going to be gruesome. So we're going into a really bad budget season. But the state government doesn't like to do ongoing funding things because they're worried if they commit their funding to like rental subsidies, what are they going to do, shut down the public schools? Like they actually do truly have a bind. But this is something that the state could do. Like the state could choose to push money out, like one-time money to bring people to date. I also think we need to make the landlords whole, right? You're not going to make a bunch of landlords very excited about housing people if people don't have to pay rent. So like we had a cataclysmic, economic event. The state could do this. The federal government could do this. Could give us, and during the pandemic, it was mostly federal funds pushed out through the state, but there was a lot of state money that went into it too. That's a nice like one-time cost. It isn't an ongoing cost that our state could decide to do, and certainly the federal government, there needs to be a lot of advocacy to ask them, because this is true all over the country. People are desperately behind in rent, and it's mostly people of color. And I am very afraid that we're going to see huge increases in homelessness in the next year or two if we don't get a hold of this. And in high cost areas like California, as soon as someone leaves that apartment, there's 10 people ready to take it to pay, but you also often lose rent control. Like if the rent was controlled, that person gets evicted. So you're not only that person is getting kicked out, but you basically are losing another unit of lower cost housing.
All right, I would like to close this up in the next less than 10 minutes, probably 5 to 6. So what we're going to do is we're going to do round robin, where we're going to ask a few people to provide their question, and then Doctor, I'm going to have to ask you to answer them as quickly as you can. So let's get your question right here. You've been raising your hand very patiently.
So, one of the things that Housing First, a big part of it is giving away free housing with no sobriety requirements. And I think it comes from a good place, but the big problems with it are it's prohibitively expensive to build and manage. I think it does attract troubled folks from elsewhere. It results in severe property damage when, if the meth gets into that drywall, people start fires. So I guess, my question is,
do you really believe that we can solve this problem by giving away more free housing, or do you think you're creating an incentive structure that's just going to make things worse?
Okay, don't answer it yet if you don't mind, doctor. Over there in the back, the person with the beard, all the way in the back corner.
Hi, about the story that you told about how you beautifully talked to that homeless woman. Was there? Do you think that the healthcare people who try to offer help to the homeless people, are they properly trained to build that trust?
Okay.
And I have one more question.
Sure.
And so my dream when I was coming from India here was to live in California, and then once in California in San Francisco. And as you have said that there's so few housing units and such a small city, am I the reason why is there so many problems? Like, in general, in a general way, like all these tech workers.
And while I see your very tall hand, the person next to you, sir, I saw earlier, so I'm going to give the question to him. I'm sorry.
We haven't talked about workforce development. Do you have a sense for what percentage of the unhoused are willing and able to work? What type of skills they have? What type of like hourly wages would be helpful, and what types of jobs we can help to make available to them?
Great. Let's try those three.
Okay, so great question about housing first. So a couple things. Housing first cannot be housing only, right? Like you take someone with a severe meth problem, you can't just throw them in a house and leave them there. It's not fair to the property owner. It's not fair to the person. It's not fair to the neighbors. It doesn't work. But again, time and time again, there's been shown that if you provide the supports to people, their drug use does go down. And they can be contained, right? So the whole free housing idea, I guess I believe that poor people need subsidized housing. There are ways to make sure that it's not people coming into the community. It isn't. It's mostly people from here, but you can also track that, right? Right now there's about a 14-year wait to get into housing in San Francisco, so they've been here for a long time, but you can make sure it isn't new people. In Santa Clara County, about 8 years ago, they challenged us to find the 400 most chaotic people. We used big data, we found them, and then we basically had 128 units of PSH, so we randomly chose. We didn't go out looking for people, we waited until they came to jail, to the psych ED, to the medical ED, or to the hospital, which they came all the time. We approached about almost 400 people. 3 people said no, they didn't want to fill out 20 forms for a 50-50 chance of housing. And once they were in the study, we randomized them. By the time we finished it in November, 7 years after, 91% of the people who we approached randomly, like they showed up in jail called us, we showed up there and said, hey, do you want to fill out 20 forms for a 50-50 chance of housing? Pretty much everyone said yes. They were on the books. We got 91% of them housed. Once they were housed, they stayed housed over 7 years for over 90% of the nights. And it took on average 2 months from the moment we met them at jail or at the psych ED until they moved into housing. Now, they had supportive services, and they kept 2 units empty because when a landlord called and was like, this person is causing chaos, the program went, they're like, you know what, sorry, they moved them out, they moved them into like another unit where they cooled them off, they got them into healthcare, they sort of calmed them down. And then the landlord was like, wow, you guys listened to me, you didn't abandon me. And they're like, I have someone else for you. And they took someone else from the program. So most people moved once because they didn't abandon the landlords. And I think that was really, really important because the landlords were the partners in this.
All right, then the
Housing
question
first.
was, is he the problem?
So you're not the problem, but the problem is that San Francisco, over a decade period, created something like 7 to 10 new jobs for every new unit of housing. What did we think was going to happen?
Yeah.
What did we think was going to happen?
Yeah.
That's the problem. Not you, but yes, the problem is that this is a place people want to live, and yet we didn't build housing for everybody. It's not the homeless folks coming in, it's everyone else coming in.
And then the question on workforce.
Workforce is a great question. So there is a significant...
And jobs that might help.
Significant proportion of the population, we're not quite sure, that probably has disabilities that right now would not let them work. There's a significant proportion of the population that could work, but is out of work. We just did this statewide study. Most people had left the workforce when they became homeless because they couldn't keep working and wanted to go back. And there's a significant proportion of people who are homeless who are working. But we fought really, really hard for a $15 wage, which I'm really glad we did, but the housing wage in the Bay Area is closer to $60. So we need to bring the wages up, but I also understand that employers can't pay everyone $60 an hour. We need to bring the cost of housing down. So we need to do two things at once, but there is a lot of workforce to do, and people who've experienced homelessness, by the way, I'm not the expert, they are the experts in this, and they are like the obvious workforce to help solve this problem, but they need to be paid well enough to live in the community to do that.
Okay, let us give Dr. Margot Kushel a round of applause. For decades of devotion to this issue, I promise I'll make my wrap up pretty quick. I promised you 75 minutes, and we're about to hit it. You may feel a little deflated, like, oh my God, it sounds like the things that are causing homelessness are not going to be able to get solved quickly. I will remind you, I know this sounds kind of corny, but Golden Gate Bridge was built in 2 years. Yeah. So 2 years to build the entire Golden Gate Bridge, if I'm not mistaken. And so it is not that the problem cannot be solved. It is that right now there are a set of things. There are ingredients in the soup that are our city. And the thing about soup is you can change ingredients pretty quickly, right? Take a couple carrots out, put a couple potatoes in. And so it's not that we lack the funds or even the solutions, it sounds, to address this issue. It is a set of other things, and we have done much harder things. And so I want to thank you for grounding us in kind of the deep causes. Tomorrow's conversation will be on the history of homelessness, and I will just say that that might be a little bit more uplifting because there have been times in this city's history where there have been far fewer homeless folks. And so that means that there can be a time in the future where there will be far fewer homeless folks. And so I know sometimes living in San Francisco in 2023 and you listen to conversations and you read the news and you're like, oh my God, it's never going to change. Grounding ourselves in the history of this town, in particular after 1906 and after 1989, will be helpful as you continue on this journey of understanding this issue. So that is on the series. Usually we promote a couple upcoming events, but I would just say stay with us. Keep coming. Come to all 4 conversations. If you can't afford a ticket, just email anyone at the Manny's team with the word grapefruit and you'll get a free ticket. Because I really want to think about this as a full suite, almost like a mini course where we go through every aspect of the issue and you're going to hear a diverse set of perspectives. I'm sorry if your question wasn't answered. I hope the doctor has a couple minutes to spend to answer individual questions if you have them. I want to thank you for your civility and your understanding, your open-mindedness. That is exactly the kind of environment that we'd like to create here. I want to thank Precious Green for being our director of programming and for opening us up tonight. Angelina Polselli is our events manager. I don't know if she's in the room.
Trivia.
She's over there. Thank you, Angelina. I'll leave you with 2 things. One, if you are not, Manny's is supported by individuals who give $36 a month to keep us open. It is a people-powered, community-funded, political and civic event space in San Francisco. It is how we're able to stay open. You can become a sponsor of Manny's by going to welcometomannys.com. Precious, I think, will also send you a link in your inbox after this. It is how we are continuing to do programming like this in the community. And so I think you think this is important. I think you've gained something from it. I surely have. And if you have the ability to support us, I'm going to ask you to do that. The second thing is maybe one final baby question. Is there a place people should go, doctor, a study people should read, a resource center for them to deepen their understanding on the causes of this issue?
So the Homelessness as a Housing Problem is a great book, and they have a great website with a lot of interactives. The National Low Income Housing Coalition, NH, National Low Income, National Low Income Housing Coalition, NLIHC is fantastic, great infographics. National Alliance to End Homelessness, and then our website at the Benioff Homelessness and Housing Initiative. We're building a new website, which will be up in about a couple weeks, which should have lots and lots of data. And so follow us there. The website's coming up in, so it's at homelessness.ucsf.edu.
All right, you can exit through the back door because we have trivia night in the front, and we will see you tomorrow for the history of homelessness in San Francisco. Thank you very much.